Hi, my name is Thanusha Pydipati, and today I'm here to discuss the prevalence of opioid usage. So, just a little bit about me. I am a rising junior at Olentangy High School in Columbus, Ohio. Last summer, I was an intern at the Past Prevention Center. I also do neuroscience research on cerebral palsy at Wayne State University. I am part of my school's HOSA and speech and debate team, and I'm the founder and president of my school's Doctors Without Borders. And my future plans include hopefully going into surgical oncology. An overview of today's presentation, I'm first going to discuss the impact of opioids on global health, then kind of discuss the opioids and their scientific mechanisms, and finally, we're going to touch on some solutions and prevention methods for opioid addiction. To preface, in the United States in 2024 alone, there were 54,743 overdose deaths. So we can track the popularity of opioids over time in three distinct waves. So wave one, we see a rise in prescription opioids, and this can mainly be attributed to the point where doctors would prescribe more and more opioids to their patients. In wave two, we can see a rise of heroin, and this is especially concerning because heroin is highly addictive due to how quickly it can overwhelm the opioid receptors in the brain. And of course, wave three is the rise of synthetic opioid overdoses. And we can see from the graph that it is still increasing past 2023 with a slight decrease, but it's still quite high. And this can mainly be attributed to synthetic opioids such as fentanyl, which have infiltrated the market and are becoming quite popular. And between the years of 1999 to 2023, we see that approximately 806,000 people died from opioid overdose, and this number is staggering, showing that opioid overdose is a serious public health issue. So to begin, opioids can be defined as a class of drugs that are derived from or mimic natural substances found in the opium poppy plant. They can typically work in a variety of different ways, but typically they're used for pain relief. I'm going to discuss some of the opioids mechanisms now of how they infiltrate your body and how they sort of work. So to begin, there's two key ways in which opioids can be administered, by injection or by mouth. By injection, opioids are just taken intravenously and they directly enter the bloodstream, allowing them to quickly target the organs that they are trying to take effect in. But by mouth, opioids are first processed and metabolized by your mouth and in your saliva, and that's called first pass metabolism. After that, it then gets swallowed and it's absorbed in the blood vessels that line the stomach and the intestines. After that, the drug is going to travel towards the liver. And once in the liver, the drug is going to be processed into its inactive forms called metabolites. And once those metabolites are formed, they enter the bloodstream again and they start taking effect in the targeted sites. On a more cellular level, we see in this graph right here, on the presynaptic membrane, the opioid is going to bind to the opioid receptor, and it's going to actually activate the G protein, and that's going to be called the GCPR pathway. And what it's going to do is it's actually going to block the amount of cyclic AMP it's going to produce, and that's a second messenger that's going to amplify the pain's response or the pain's message. It's also going to decrease the amount of calcium that's going to enter the presynaptic membrane. And then if we look over at the postsynaptic membrane, we see that from the opioid binding to the receptor, a lot more potassium is leaving the cell and a lot more chlorine is entering the cell. It's going to lead to something called hyperpolarization, which is when the inside of a neuron is going to get more negative, and that's going to be much harder to create an action potential. So overall, what the opioid is trying to do is it's going to make it really hard for these cells to communicate with each other, which is going to decrease the overall pain response. Now, there is a cycle of addiction that's important to note when using opioids. So number one, we see initial use. So initial use can happen due to a variety of different factors, such as familial situations or socioeconomic backgrounds. Then we're going to go into misuse. Misuse is when people start to use the opioid more frequently or in higher dosages, and that is what causes them to start getting in the cycle of being addicted. After misuse, we see tolerance, and tolerance is when you need to take more of a drug to produce the same desired effect. This is showing that the opioid is actually changing your brain's chemistry. And finally, we go into dependence. Dependence is when your body starts to crave the opioid and you can't seem to go a few hours without having it. Then, of course, we go into addiction. Addiction is when you are constantly craving the opioid. It's distracting you from doing your hobbies, maintaining your relationships, daily habits. And finally, there's relapse. Typically, once people are in addiction, they try to quit, but there's always some sort of trigger sometimes that'll help them relapse. The best way to break addiction, though, is by interrupting this cycle. Here are some long-term solutions that have been seen to work. We've seen first, educational programs have been extremely popular. They help promote awareness about opioids and train people to better understand the effects of them. Next, we have practicing health equity. Typically, the places that suffer from more opioid overdoses and opioid use are places that have lower socioeconomic backgrounds and not as many resources. By giving these places more resources and providing them with more support, we're actually allowing for these hot spots of opioid misuse to be alleviated. And finally, we have peer counseling networks, which have been shown to be just as effective as some professional counseling. How this works is that someone who's already beat the opioid addiction comes in and talks to someone who is going through the program currently, and it's been found to have a ton of mutual empathy and understanding, and that is a great way to help people get out of that addiction cycle. Here are my references, my acknowledgments. Thank you to the GHLC at Johns Hopkins for presenting this opportunity, to past mental health services for information on prevention programs during my internship, and of course, thank you to my audience for listening to my presentation. And here's my contact information if needed. But once again, thank you so much for listening.